A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a bold and controversial decision, U.S. Health Secretary Robert F. Kennedy Jr. announced on Monday that he has removed all 17 members of the Advisory Committee on Immunization Practices, ACIP, the key scientific body that advises the Centers for Disease Control and Prevention, CDC, on vaccine use. This unprecedented action has drawn sharp criticism from major physicians and public health groups, who argue that it undermines the integrity of vaccine policy and public trust in health recommendations. Kennedy, who has a history as one of the nation's leading anti-vaccine activists, has yet to reveal his choices for the new committee members, but he has indicated that the panel will reconvene in just 2 weeks in Atlanta. The current members of ACIP, all appointed during President Joe Biden's administration, were seen as a bipartisan group, but Kennedy's decision to replace them marks a significant shift in the management of vaccine advisory processes. In an opinion piece published in the Wall Street Journal, Kennedy stated, "Without removing the current members, the current Trump administration would not have been able to appoint a majority of new members until 2028. A clean sweep is needed to re-establish public confidence in vaccine science." However, critics argue that this move is more about political maneuvering than genuine concern for public health. Dr. Helen Keep Talbot, the former chair of the committee, declined to comment on her dismissal, but panel member Noel Brewer expressed his surprise at the abrupt termination of his role. Brewer, a behavioral scientist at the University of North Carolina, emphasized the importance of ACIP's recommendations, which have historically served as the gold standard for vaccination guidance in the U.S. He noted, "Up until today, ACIP recommendations were the gold standard for what insurers should pay for, what providers should recommend, and what the public should look to." Despite the controversy, Kennedy has defended his decision, claiming that the committee members had too many conflicts of interest. Current guidelines require committee members to disclose any potential conflicts and business interests. However, Dr. Tom Frieden, former CDC director and president of Resolve to Save Lives, criticized Kennedy's actions as being based on false claims of conflict of interest, arguing that they jeopardize vaccine access for millions. Frieden stated, "Make no mistake, politicizing the ACIP as Secretary Kennedy is doing will undermine public trust under the guise of improving it." The fallout from this decision raises serious questions about the future of vaccine policy in the U.S. Dr. George Benjamin, executive director of the American Public Health Association, described the mass ouster as a coup that could have dire consequences for public health. He stated, "It's not how democracies work. It's not good for the health of the nation." The American Medical Association echoed these concerns, warning that Kennedy's actions could lead to an increase in vaccine-preventable diseases at a time when vaccination rates are already declining. The committee has faced instability since Kennedy's appointment, with recent meetings postponed and uncertainty surrounding its direction. During his confirmation, Kennedy had assured lawmakers that he would respect the committee's recommendations. However, the sudden removal of its members has left many questioning his commitment to public health. The webpage listing the committee's members was deleted shortly after Kennedy's announcement, further indicating a significant shift in the administration's approach to vaccine policy. As the nation watches closely, the implications of Kennedy's decision remain to be seen. Will the new committee restore public trust in vaccines, or will it further politicize an already contentious issue? The coming weeks will be crucial as the new appointees prepare to meet and outline their vision for vaccine guidance in the U.S. In a time when public health is under scrutiny and vaccination remains a hot-button topic, Kennedy's actions could have lasting repercussions on how vaccines are perceived and administered across the country. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.